1-year-old boy is brought to emergency room by his parents because of inconsolable crying and diarrhea for the past 6 hours. As the physician is concerned about acute appendicitis, she consults the literature base. She finds a paper with a table that summarizes data regarding the diagnostic accuracy of multiple clinical findings for appendicitis. Based on the table, the absence of which of the following clinical finding would most accurately rule out appendicitis in this patient? So this is the 1-year-old patient. So you need to rule out. So for ruling out, it is the sensitivity that should be high. If higher the sensitivity, there will be more chances of ruling out this particular disease. So in 1-year-old child, we have to see which of the following will have this abdominal rebound. It is in greater than 5 years. So we'll remove that thing. Vomiting, okay, it is in all ages. For 1 month to 2 years, so we can include it in all ages and all ages. So abdominal rebound is to be removed. Apart from it, the one with the highest amount of sensitivity will be your answer. As simple as that. So it was this particular question. So we were supposed to rule out appendicitis. For ruling out, we will require the one with highest sensitivity, but it was in a 1-year-old patient. So 1-year-old patient would not have abdominal rebound. So 0.80, which is 1 month to 2 years of age, will work. That should be fever. The correct answer is B, which is fever. In this table, fever has highest sensitivity for acute appendicitis in children under the age of 2 years. If a high sensitive test yields a negative result, the disease can be more reliably ruled out. For this reason, tests with higher sensitivity are often used for screening purposes. Abdominal rebound, which has even higher sensitivity, has only been assessed in children more than 5 years of age and can therefore not.
Thanks for watching. Please give a thumbs up and subscribe for more.